about our Walk with Ease class this morning?
It was so awesome.
Wasn't that lady amazing? I can't think of her name.
Oh, Betty.
Yes.
She did 1.5 miles today.
It's amazing, because just a couple weeks ago, she couldn't even do one lap around the mall.
I'm so proud of her. And she said she had less pain, too.
And her confidence and her stress levels down, and she's just doing amazing.
I'm so
proud of
glad
us.
we meet 3 times a
I
week.
know. What a great class.
Yeah, I'm going to tell everyone about it.
Oh, that's awesome.
Honestly, Lori thinks her program's so great. Walking's like the first thing kids know how to do. I teach in schools and I educate them on developing personal boundaries and how to maintain those boundaries when challenged. And she thinks because she goes on a walk, she should get this gold star. Let me tell you. I also teach comprehensive sex education, 7th through 9th grade. In those classes, which include abstinence talking, positive relationships, and sexual health as well. Since our program has been implemented into the schools, we've lowered the unplanned pregnancy rates by 32.3%. Where's my gold star?
How about Stephanie? She thinks her program is so important. Yeah, she is important, but we actually screen for breast and cervical cancer. I mean, come on. Early detection saves lives.
For sure. And like our tobacco prevention program.
I know. We refer people to the quit line.
We helped a lot of people stop smoking.
Stephanie. Wow.
I help run our HIV early intervention services through the health department. Sorry, she does this all the time. So anyways, I'm so sorry about that. But I run our HIV early intervention services, which is basically just educating and outreach and testing throughout the community, as well as helping providers and people understand the basics of HIV and how important it is to really have an open, clear communication in our community discussing HIV. Yeah, I also do free testing Mondays, well actually Wednesdays and Fridays, sorry, no Mondays anymore. And Wednesdays it's 1 to 4 and Fridays it's 9 to noon.
People think our job is all fun and games. Well, it is fun and we do play games. Yeah, but as a parent, as teacher, home visitor, you are also working with the families, connecting them to other resources, connecting them to other families. You're doing child development assessments and group activities.
And as a nurse in the Nurse Family Partnership, you do all those same things, but also you're able to assess pregnant moms, and you can also assess medical needs and lactation needs of mothers and their families.
Yeah, we do a lot.
Hi, I'm Rebecca and I'm the asthma nurse at the health department. Part of working at the health department is helping people to be healthy. And to be healthy, well, you gotta be able to breathe. So I help people with their inhalers. Yay! So I work with families and doctors, and I help families understand the medications they need to take, what triggers their asthma, and we go into their house and we evaluate their home environment to see if there's anything we can do to change the home environment to make their asthma better. We give them bed liners, mattress covers that keep dust mites in so that the dust mites don't irritate their asthma. We also give out HEPA filters and basically help kids breathe better.
I think a lot of my coworkers think what happens in this room is latching babies, and that's a big part of what I do. And it is, but there's a lot more than that. Parents come to see me because their babies aren't gaining weight as fast as they want to, or they have painful breastfeeding, or they're worried about what's going to happen when they go back to work. And so we take a really detailed look at parents' reproductive history and what's been going on with breastfeeding up until this point, and then come up with a plan that meets the family's goals and the doctor's goals and what's right for the baby. And it's not always latching, it's not always working on latch. A lot of times it's things like figuring out other ways to feed baby, like using bottles, using cups, using syringes, or even supplemental nursing systems. A big chunk of my time is helping parents pump or learn different ways of milk expression. And a lot of what I do is help families figure out how to talk to their partners, to their daycare providers, and to their employers about the things that they can do that can promote and protect and support breastfeeding.
The Butte program, it's a supplemental nutrition program for women, infants, and children. It also is supplemental for foster care as well, grandmas, grandpas, and ward of state children. What we do is we educate on nutrition, best nutrition to cut down on childhood obesity. We also do height, weight, and blood work. Part of the blood work goes out to lead abatement if they have high lead levels when we do the draw. We are the main portal for other services as well. We refer out to many people in the area.
Don't forget about car seats.
Oh yeah, car seats. We have a car seat clinic with certified car seat technicians up at the fire department every third Wednesday of the month from 11 to 2. We ask that you don't come later than 1:30. They can help you up there, install your car seats, know exactly where you should put them within the vehicle, and they ask for a $30 donation. If you can't provide the $30 donation for brand new car seats, they won't turn anybody away.
Let me tell you, family planning is where it's at. We have highly skilled clinicians that come in and provide confidential services that we provide on a sliding fee scale. And whether or not you have insurance or a job, we provide STD testing and treatment, HIV and hepatitis C, testing, counseling, and referral services. And we also provide pregnancy testing and counseling and breast and cervical cancer screenings, birth control supplies for men, women, and teens, including oral contraceptive pills, Depo-Provera, NuvaRing, IUD, Nexplanon, and condoms, as well as emergency contraception and male and female reproductive services.
For more information or to make an appointment, call 497-5080.
So nursing is one of the programs that is at the heart of public health. As the medical provider is treating the patient with an infectious disease, public health will step in and take steps to put measures into place to keep the population safe. So this will actually help keep our community safe and healthy.
Oh, I've been so busy all day giving shots, but I do have a few minutes to tell you what I do here.
We provide all immunizations for the ages of 2 months through adults. We are your travel headquarters. We specialize in every vaccine available to the United States public. We offer all the specialized vaccines such as typhoid, rabies, and Japanese encephalitis. We offer the new meningitis B vaccine from the ages of 16 through 23 for healthy adolescents. Teens need meningitis vaccine at different age platforms from the ages of 11 through 12 and then a booster at 16 and up. And if you haven't had your flu vaccine, it's time to do so now. It is widespread in Montana and very problematic. Call 497-5020 for an appointment, and clinic hours are Monday through Friday, 8 to 5.
Some of the things we do at the Environmental Health Department is air quality. We have a monitor station down at Greeley School. Another part of it is our food and consumer safety section. And in that we do inspections of licensed facilities. These facilities are daycares, public accommodations, public pools and spas, and our biggest one is retail food inspections. And so we try to keep our community healthy through these inspections and assuring that the public have safe food to eat. The last part of our program is land management, and that's water quality issues. Also, we do subdivision reviews, and the subdivision reviews are required for property to be subdivided, that they have proper septic, proper water, and proper stormwater. And our last part is we actually issue septic permits for on-site wastewater facilities. So that's a brief summary of what we do at the health department for the environmental division. Thanks.
And action.
Should I get my Public Health Week notes? They're around here somewhere. Where are my notes? What we do at the Butte Silver Bow Public Health Department, we work every day to make Butte a healthier place to live and raise families. We at the health department work on programs that really intervene to make Butte healthier. Even before babies are born, we're working with families to make them healthier. We work a lot in prevention. There is a lot of power in prevention, and we are really talking about the power of prevention as we go about our daily work lives. We employ about 29 people at the health department who work on this. We work on everything from home visiting. We go right into the homes of people who need our assistance and work with them at home. We have take great pride in our Title X Family Planning Clinic. We have a strong and vital immunization program. We go into the schools and we talk to kids about taking personal responsibility for their lives, and in that way, it's our modern day version of sex education, and we're keeping kids healthy and safe. We have a full and vibrant environmental health division. We inspect 100% of our restaurants every year, ensuring that the people of Butte are safe when they're eating in a restaurant. They'll know that we have inspected that restaurant for food safety. We also teach people quarterly. We bring a variety of food managers into our department and teach them about food safety. This department and public health interests are represented in all things Superfund in Butte. We ensure that public health interests are represented when we're talking about the Butte Priority Soils Operable Unit of the Superfund area. We ensure the public health interests are represented when we're talking about the Berkeley Pit or when we're talking about the Montana Pole operable site. We ensure that people are represented in that way. Oh, here they are.